Good morning, I'm Jessica Lovell. Today, we bring you an encore presentation of one of our very favorite programs. Our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. If there is an urgent update from the health system, of course, we will be here to let you know first. Until then, please enjoy this encore presentation and make it a great day.
I might have died. I mean, that's the truth. Had I waited till 40.
Coming up today, the cancer burden is slowly shifting from men to women, from older to younger. We ask what that means for breast cancer specifically, and meet one young survivor sharing her message with other young women. Good morning, I'm Angie Riccono. Welcome to the Morning Medical Update. We tend to think of cancer as an older person's disease. And generally speaking, yes, most cancer cases occur in people 65 and older. But oncologists are seeing an increase in younger patients, people in their 40s and 30s or even younger. Here's Jessica Lovell.
The newest numbers from the American Cancer Society show women under 50 are being diagnosed at a higher rate than men under 50. These graphs show the rate of new cancer diagnoses from 1998 to 2021. The left graph is people under 50. The middle is ages 50 to 64, and the right is ages 65 and up. The blue lines are men and the pink lines are women. Now focus on the left graph, people under 50. You'll see that the blue line went down a little in the past decade, while the pink line went up. That means cancer rates are rising for women under 50, and young women are now nearly twice as likely to be diagnosed as young men. Looking at the middle graph for people ages 50 to 64, cancer rates used to be higher among men. But the two lines crossed in 2021, meaning middle-aged women now have a slightly higher risk of developing cancer than their male counterparts.
This new report says the rising rate of cancer in young women is mostly due to breast cancer. And while that is concerning, the good news is that more women than ever are surviving breast cancer. And today we're meeting one of those young survivors. Alex Owens was diagnosed with breast cancer at age 33 and recently marked 1 year of being cancer-free. You may have recently seen her story on KSHB Channel 41.
I'm very lucky that we caught it when we did. I'm shocked I was not further along with my staging because it was a pretty sizable tumor, and it had already spread to a few lymph nodes.
Mammograms aren't recommended until age 40. Alex says she discovered the tumor during a self-breast exam 7 years earlier at age 33.
I know that if I had waited till 40, I would have probably been a stage 3 or 4. I mean, that's years, right? 33 to 40. I probably would have gone in with some other symptom and found out I had cancer all over my body.
Since then, Alex has shared her experience publicly on social media, and the results have been stunning.
Within the last year and a half, I've had already a handful or more of women reach out to me because they've been diagnosed, and a lot of them found it themselves. They're in their late 20s and early 30s. One of them was 28 with a toddler.
Alex Owens joins us in the studio today. How are you?
I'm good. How are you?
Thank you so much for being here and sharing your story. And also joining us is Alex's breast surgical oncologist at the University of Kansas Cancer Center, Dr. Lindsay Kilgore, and welcome back. Thank you for being here this morning. Now, Alex, I know you caught this with a self-exam. How often were you doing these self-checks?
You know, I can't say how often that I was probably doing them. I have a family history on both sides of my family that I was aware of, and so I would check around here and there. I had 2 kids, so I had a lot of changes in my breasts over the last several years. And one night after a Christmas party, I just happened to be like having my arm right over on my right side, and I was brushing my teeth, and I felt something that did not feel normal for me.
Yeah, and then when you say you have a family history, who is that?
So my dad's sister and my mom's sister have both had breast cancer.
Aunts.
And so aunts, So neither of my parents had cancer, but both of my aunts on both sides. And one of my aunts on my dad's side, his sister, and we ended up having a very similar experience, our cancer journeys. And then recently, my dad's other sister was just diagnosed with breast cancer.
And were they young when they were diagnosed?
They weren't. So they were not old. So I had a great aunt on my dad's side that had breast cancer in her 70s. She refused a lot of treatment, so she did end up eventually passing away from breast cancer just because she didn't want to treat it. Both of my aunts on both sides were in their right around 50 when they were diagnosed. So not super old, but not super young, over that 40 threshold. And I think back when they were diagnosed, this was 15 plus years ago ish. And I think the guidelines might have been a little bit different back then. It might have been 50 for your first mammogram, or 45. It was not as young as 40. I know that, and so at 33, that seemed very young.
Right. Now, knowing that you had a family history, did you do any genetic testing, or is it just something that you had kept in the back of your mind?
I did end up doing the genetic testing from the guidance of my doctors, and especially because we knew there was a family history there. So it was like, okay, let's go ahead, let's do the genetic testing. I had a feeling that I wasn't going to test positive for the BRCA gene or some of those larger, more known diseases that could signal that you were at a greater risk of developing breast cancer, because both of my aunts had done the genetic testing 10 years ago or so, and they both did not show that they had any of those major risk genetic mutations. And I as well did not show that I had any of these major genetic mutations, but I did the larger gene panel because I knew that that was probably going to happen. And I did have a genetic mutation, but we still don't know if that was necessarily what the cause of my cancer was. It's it was a variant of unknown significance. Basically, they don't have enough history and data on it to really know if that was it, but it was called RAD50, and my aunt is also a carrier for that genetic mutation. Wow. So my dad is a carrier, his sister has it, and we found out that my sister has it too.
Okay, and that's good information to know. Dr. Kilgore, I want to ask you about recommendations for mammograms, because they have changed. I know what you're saying, Alex, because it's a conversation I've had with my friends. What is it right now? Let's start there.
So screening mammograms are recommended at the age of 40 unless you're at higher risk, and that's where this really comes into individualized medicine and understanding your family's risk, your risk of a potential breast cancer. Like for Alex, she had a family history, so she was aware that she should be doing self-exams even though actual screening wasn't recommended. So it's really important that women are breast aware, is what we call it. And like she said, she happened to just feel this mass. And so every woman should really be aware about what their breasts are like now and if they notice any changes.
What puts a woman at higher risk? Is it just having family members with breast cancer? What do you tell women?
Yeah, so we tell them family history of breast cancer. There's several other factors that can lead into that. And so we do, a whole risk calculator to figure out, are you low high risk, medium high risk, high risk? So it's really important that you have that conversation with your provider, because it's not just family history. And that's, I think, something that's interesting is, a lot of younger women that are coming into us don't have genetic mutations. So we don't necessarily know the causes of why they're getting these breast cancers, and that's why everyone really needs to be aware of their breast, because screening guidelines are still mammograms at the age of 40 unless there's things that put them at higher risk.
So I know we have risk calculators, and people will probably Google and find something and try to do it themselves. What do you recommend, and then also what do you discourage?
Yeah, you can go on to random online calculators and type in things, but unless it's done by a provider who really knows the trustworthy ones, like the Tyrer-Cuzick risk calculator is one that we commonly use here at KU, they all have benefits and risks. I mean, some overestimate your risk and some underestimate your risk. And so you really don't want to just be haphazardly doing that on your own. If you think you're high risk, we actually have high-risk clinics where providers can do that for you. And then based on your risk, they will decide if you benefit from additional early earlier screening, or even maybe even risk reducing medicines.
And isn't that the important part, is to be able to put it all into perspective?
Yes.
So maybe I Google and I get like a score, but it's like, what does that mean?
Exactly. And you know, when you get that score, you may freak out about a percentage, but it actually may be on the lower end of percentages for women in your age group. And so it's having someone interpret that information with you, because even anyone that is higher risk doesn't necessarily mean they need to go have double mastectomies. You know, there's other risk modification strategies, healthy lifestyle, medications, et cetera, that we recommend for people.
Yeah. Now, Alex, I know you were obviously very young when you were diagnosed. Did you have peers that you could speak with also in your age range about that?
Not really. I knew only one person who had had breast cancer at a younger age. And funny enough, she actually was in the news industry as well previously, so that's how I had known her. But she wasn't here in Kansas City anymore. And I think she did have the BRCA gene. So it was a little bit of a different experience. But, you know, I didn't know anybody who was younger who had been going through what I went through, or at least breast cancer specifically. And I struggled to find that. You know, of course, you like go to Google and you go online, you try and find support groups, and the support groups were a little scary to me, like on the Facebook groups, because I would go down these rabbit holes where if I was reading what somebody's experience was, you start to go down a bit of a rabbit hole. So I had to protect my mental health a little bit, and I didn't use the Facebook support groups as much because it was
and
scary
that makes
for me.
sense. And then also you want to be able to connect with people where you have commonality.
Yeah.
I think that's why Alex has been such an inspiration for younger patients that have breast cancer, and why she said people have been reaching out to her. I mean, showing her journey and staying positive. You know, chemo's not fun, treatment's not fun, but you've been a rock star through it all, and showing them that there's light at the end of the tunnel. So, I mean, I think it's been amazing for younger patients, and to just bring awareness to everything.
Absolutely. And we know that you've been very vocal about your experience online, kind of shedding some light on all of this. And it's actually helped one of your friends in a very big way. So let's meet that friend right now. Emily Moritz joins us live via webcam. She's currently going through treatment for breast cancer. Good morning.
Good morning.
So how did you learn that you had cancer?
Yeah, so last September I was taking a shower and I felt a lump. It felt like small, marble-like, just did not feel like anything that I had felt before. So I immediately messaged my OB the next morning. They got me in for an appointment later that week. And then after a series of imaging appointments, I had multiple ultrasounds and a mammogram. I met with my now breast surgeon who did a biopsy, and that came back malignant on October 1st of last year.
Wow. Okay. What is the status of your treatment right now?
So I actually just finished chemotherapy on March 11th. So I had 6 rounds every 3 weeks. I started last November, and then I have HER2 positive status. So I'll continue immunotherapy through next November. And then I will be having surgery or later this month on April 18th, and followed by radiation.
Yeah, I know that's a lot to go through. Are you getting any guidance or advice from Alex?
Yeah, she's been great. So honestly, such a supportive advocate for me, being so young also. Like, I have other women in my life that have had breast cancer and survived breast cancer, but it's very different when you have and you know somebody that's going or has gone through it at a similar age as you. And she was honestly one of the first people I told. The first week I was diagnosed, I contacted her and we had a long conversation. And she's also connected me with somebody else who's similar to my age and going through the same treatment that I am. So she's been wonderful.
That's great to hear. Now you have to tell us about your cold cap. We could see it in some of the pictures.
Yeah.
How does this work?
Yeah, so also something that Alex told me about, Penguin cold capping is who I use. We get a delivery of dry ice the day before. We found somebody local that delivers to our house. So we get that delivery the day before chemotherapy. My husband has everything packed up and ready. You cool the caps first. So I think it's for about 30 minutes to 45 minutes before you start the first chemotherapy. Cool everything down, get it to negative 35 degrees Celsius. And you change the cap every 25 minutes throughout chemo. And then for the regimen that I'm on, the chemo regimen that I'm on, we'll continue it for 5 hours post chemo. So it ends up being about 8 hours total in the day of having the cold capping.
Wow. Well, I mean, I've noticed, do you feel like you've lost hair? Because it looks like you have a full head of hair there.
Honestly, I haven't. I've had the normal shedding, but I mean, anytime we shower, we can only wash our hair in cool water once a week. So I feel like that's pretty normal for I have the normal shedding of somebody that washes their hair once a week. So I personally haven't noticed any hair on my head that I've lost. I've definitely lost some of my eyelashes and eyebrows, but I've been really happy with doing cold capping and would highly recommend it, and would absolutely talk to anybody that's interested in doing it that has to go through chemo in the future.
And it's great to have a guide where someone can explain all of this and let you know what you're feeling and what you can expect with all of this. We do want to let everybody at home join in the conversation. If you're watching live, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can also email the Medical News Network, and that information is on your screen. Now, Alex, I wanted to ask you, how did you handle the treatment mentally? Because this is a lot to go through.
Yeah, I mean, when you're first diagnosed, so Dr. Kilgore was the first doctor I met with, and so sorry, because you probably got the worst of it. I definitely had my moments of crying, and it's a rough thing to get told that you have breast cancer, especially when you've got, I had 2 babies at home. Yeah. I had a 3-year-old and a 1-year-old at home. And I know Emily also has a kid, and one of my other friends who was diagnosed at a very young age in her 20s also had a toddler. It's a gut punch. It's rough. But I think from what I've talked to with Emily and our other friend, it's you get to a point where you kind of go, well, I can sit here and feel sorry for myself and let it be a really horrible experience and, affect my family, affect my friends, and be a lot harder to climb out of, or I can just buckle up and kind of move forward and try and be as positive as possible. And so that's what I chose to do. And it made it easier, I think. I've seen other people who did let it affect them into a point where it was just everything was petrifying to them, crippling anxiety, and I was like, I can't do that.
Yeah, because you've got to function. You've got little kids.
I had to function. Yeah. And so I had a great support system, which was also something that not everybody has. I feel very blessed and very lucky that for, as horrible as the situation was, I had a great husband. I had an amazing family and friends that were in town, and everybody really rallied around me and helped me stay positive. And for me, not letting myself go too deep into my emotional pit is what I would call it, helped me stay a little bit steadier. So I just tried to focus on the good. There are still hard days. I mean, even now post-treatment, there are hard days, but overall, it wasn't as bad as I thought.
Good. That's good to hear. Emily, how about you? How are you doing mental health-wise?
So I would share the same sentiments as Alex. I think the hardest part is initially getting the diagnosis and having all the unknowns. So you just have so many questions, so many doctor's appointments that you're not used to going to, so many words and phrases and medical terms that are so unknown to you. So I would say that's definitely the hardest part. And that's where Alex really came in and helped me from a mental state of, once you get through this point, it gets easier from here. I waited a little bit for my first treatment because we did a round of IVF. We know we want to have more babies in the future. So it took me about 2 months from my initial diagnosis to the beginning of treatment. And I would say once we got to the first treatment part, I was just ready to go. I was, ready to kick this thing. I was ready to be done with it at the beginning of it. Throughout chemo, I think it was a little bit harder, but then towards the end of it, knowing that, there's a light at the end of the tunnel, we're almost done. We only have, 1 to 2 treatments left. It was a lot easier. And with Alex, I have a great support system. We have our family close now. Our friends have been great, always checking in, knowing when my next treatment was to, send me letters of encouragement or sending flowers or meals. Everything was just, was fantastic. And I feel now that I'm done with chemotherapy, we're really getting to that light. I have surgery and radiation left, but I think I'm really through the hard part. And I would agree. I think I was expecting a little bit worse. Not that chemo is at all easy. It was probably one of the hardest things I've been through, but easier than I think that I expected it to be.
Yeah, and Dr. Kilgore, I wanted to ask you about that. I think they're both exposing something about younger women. I'm sure it's different when you're treating a patient who is younger than than when you're treating a patient who may be in their 50s.
Yeah, absolutely. I mean, they reference, just having children, young children, and
IVF.
Trying to balance life. And do you want more kids? And so then meeting with fertility specialists. And it's okay to wait, just like she did. Wait for your treatment to start so you can take care of fertility if that's something that's important to you. And we wouldn't offer it if it wasn't safe. And that's the thing, is some people just want to rush into treatments like, well, I need to have this if I have cancer. And it's reassurance that it's okay to prioritize your future life. You're going through all this treatment so you can keep living. And what's going to help you keep living? And if that's having another child, what are your priorities? And so I think it's really sitting down with your younger patients, looking at like what's the ultimate end goal versus everyone who's just kind of here in the now, shocked of their diagnosis. And so taking the time to really be like, hey, let's look at the future. Right now, I know you're so stuck in the present, and this is a big diagnosis, but where is your future at? Where do you want to be? And we're going to help you get there.
And is that something that you try to do with patients when they come in? Because it's emotionally overwhelming. Is that what you're trying to do, is help them navigate everything and
Absolutely.
say, don't just focus on this, but let's focus on the future?
Yeah, it's the whole big picture. I mean, that's the whole point of why they're going through this. You're going through the chemotherapy and all these hard treatments so that you can keep living life and be with your kids when they're older, and what's the future going to look like for you? And so it's me trying to show them that big picture and perspective. Like, it's not going to be a sprint. It's going to be a marathon. It's going to be a long journey, as she knows, but we're going to get you there. And that's the whole point of all this.
So Alex, let's talk about that, after going through all treatment. What have been like the biggest changes for you?
I mean, honestly, just like looking at life with a bit of a new light, like what's important, what's not important, and trying my best. I mean, some days are harder than others, but trying my best to not let like little things that just really don't matter at the end of the day get to me. It's like, okay, is this going to be important to me in a year, 5 years, 10 years? If not, ugh. And I think too, you just kind of start to realize, like, again, what is important, and that really, like, the people in your life, they're the most important thing, right? Your health is one of the most important things, because you can't enjoy your life if you're not healthy to the fullest extent, right? So I was always a healthy person, and I know for Emily, same thing. Like, she really took care of her health. And so it's wild, because you're like, well, I'm a healthy person. Why did I get it? I don't know. I mean, I don't have a crystal ball, but I do think that we're here on this earth to help people, and so that's just kind of been my mission.
So somewhat of the gift of perspective
Yeah.
in all of this. Okay, let's look at some of the questions that we have gotten from our viewers. Stu wants to know, should the mammogram age guidelines be lowered? Maybe we'll let you take that, doctor.
Yeah. So it's based on, the overall population. So although we are seeing trends in younger women, we still have to figure out why these trends are happening and if the benefit of screening everyone at a younger age is important. And that's why right now, not currently, unless someone's higher risk. And that's why I say risk assessment's important, but breast awareness. I can't emphasize that enough, that if you feel something, don't blow it off. Reach out to one of your providers, your OB, your family provider, and don't just blow it off like, oh, I think that's a cyst. I used to have cysts in my breast, or even myself, I felt something and I was like, well, I know that's dense tissue. I do 1 million breast exams every day, and no, I went and got it checked out, because I shouldn't blow things off, because I'm like, what if? I've had so many young patients. So really just doing those self exams and being aware of your breast is the most important right now.
Okay, Amy is asking, how does diet impact breast cancer risk? Is there anything to avoid, or maybe something to add?
Yeah, we always just talk about healthy lifestyle. Everyone wants to know, should I cut out all sugar? Should I do this? And overall well-being and health and exercising regularly, 3 to 5 times a week, limiting alcohol use, limiting sugar, but not just cutting out everything. I also tell people, there's a risk, obviously, to getting cancers by your diet and your exercise and other things, but you also need to live your life and not live in fear and limit so much of the things that you enjoy.
Yeah, okay, here's another one, and this is for Alex. When people are reaching out, what questions or concerns do they have? Like, what's that first conversation?
It's usually like, what's going to happen?
Yeah.
Is this going to be hard? What's it going to look like? What advice can you give me? What do I do next? And so...
what advice do you give them?
You got this.
You've got this.
Yeah, you've got this. I mean, truly... I'm trying not to cry. Emily called me, and it was a bit of a gut punch for me too, because I've known Emily since high school.
Yeah.
And every time somebody new reaches out to me, it's hard, because
Sure.
it kind of puts you back into that place. Thank you.
Yeah.
It puts you back into that place of when you were diagnosed and how difficult that was. And seeing people close to you that you know and that you love and you have a history with, it's really hard to know, like, oh, they're going to be up against this too. But it was good for me to be able to be there for other people, since people were there for me to say, like, okay, it was hard, I got through it, I'm good. You got this, you're going to get through it, and I'm here for whatever, you need. So yeah, it's just, you got this. You can do it.
Yeah.
It looks hard, but you got it.
That's good advice. Emily, we always like to wrap it up with some final thoughts from our guest. What would you want people at home to know?
I think just the importance of self-breast exams, especially for women my age that are of childbearing age and have had kids, have breastfed. There's a lot of changes that go on during and after that process. Just knowing what your normal is and don't brush anything off is super important. And the other thing that Dr. Kilgore touched on just a little bit is you have time, so don't rush into decisions. Again, there's so many unknowns. Like I mentioned earlier, there's so many medical terms that are thrown at you that you may be unaware of, especially if you're not of medical background. And so if you need second opinions, if you're not feeling like you are super satisfied with your care team, definitely get those second opinions and make sure you're comfortable with the treatments and comfortable with your doctors, because you're going to be spending a lot of time with them and they're going to be giving you a lot of advice and helping you through the process. So just making sure you're super comfortable with them and you trust them.
Yeah, Emily, thank you so much for joining us here today, and we wish you the best of luck. I really appreciate that. Dr. Kilgore, what are your final takeaways for women out there?
I think Emily said it well. Really advocate for yourself. If you feel something, if you're concerned, if a provider brushes it off or says, oh no, we'll just watch it. No, fight for yourself, advocate for yourself. You know your body, you know what's normal or not normal. And especially like she mentioned around breastfeeding, you have normal breast changes. People may say, oh, that's just normal ductal tissue or, mastitis. No, be aware, advocate, follow up. And like she said, your care team's the most important. So I think that, having the people around you that want the same things that you do, take time to make decisions, and really feel like you've got the best people around you. And if you don't, not all right teams are right for you, so find that right team, because it's, like I said, it's a marathon, not a sprint.
And that's what I was going to ask. Is it important to get a second opinion, to get with that team that makes you feel comfortable?
Absolutely. I can't emphasize it enough. Even if someone, comes to me and I don't know that we're a right mesh or a fit, I say, seek that second opinion. You need to be comfortable and confident with what you're going to go through, because those treatments are not going to be easy, and you want to really truly believe in your team and get a sense of peace that you're at the place where you want to be treated.
Yeah. And then Alex, what's your final thought for everyone out there?
So today is April 1st. And we always say, Emily and I too, feel on the 1st. So that's a great reminder to be breast aware, is every month on the 1st, feel around, check it out. It's the same thing that both of these ladies are saying. You have to be an advocate for yourself, and you have to be aware of your body. And that's hard to do, especially I think as a young woman, especially if you've got kids, because we are kind of ingrained and taught to like put everybody else first.
Of course.
And it's been a bit of a reprogramming for me to say, I can't take care of others if I don't take care of myself first.
Good advice, everyone. Thank you so much for joining us here this morning.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.